ADHD means attention deficit hyperactivity disorder, which is differentiated from ADD because there's less hyperactivity. What we see as children evolve into adults, we see much less hyperactivity. So in adults, we see much more ADD. Well, they're really interchangeable. It's, some people really want to emphasize the hyperactive component to the disorder, which is really attention deficit disorder, without the hyperactivity. So generally, adults see more ADD than ADHD. It appears that as people age, they become less hyperactive. The development of ADHD is really a more complicated question. Basically, it's really a genetic disorder, and we see it in families. It's really dominantly inherited. So we see this genetically. We see the environment can bring it out. We see it in families. It runs in families. We ask people if it runs in their family, and generally it's prevalent in families. And it's much more prevalent than we would ever think. I mean, there's like maybe 8 million people in the United States that suffer from this disorder. So it's really, not rare at all. And I think we're diagnosing it much more as we move along and become more sophisticated. In terms of the top 3 signs, certainly distractibility. People feel that they just can't focus. They need to be in non-stimulating environments. They are constantly getting up from their chair and having to do all kinds of activities. They can't remain focused, so they're highly distracted. They certainly don't listen to others, and people complain about that, and they just don't follow through. They're not well organized, so they don't. They go from subject to subject. They don't seem to focus on what's going on around them. I think those are kind of the things that the people really see. Absolutely. I strongly recommend the treatment of ADD in adults. Actually, it's become one of the parts of my practice that I found most fulfilling, because people do so well with this treatment. Firstly, in terms of seeking help, this is a very treatable disorder. And a lot of people have stigmas about taking medication. I see this quite often, especially with parents with young children, and I definitely understand. They don't want their kids to be medicated, and adults sometimes can have also aversion to medications, but usually the medications are very well tolerated. And I would say 80-90% of the cure, not cure, but at least people recovering from it being able to function very well are with medication management. There's very few side effects associated with it, and people have profound changes in how they function. It's really been some of the most rewarding cases in my experience in psychiatry, is to see people with ADD. Now, there's a lot of reasons also that people are inattentive. I mean, there's medical reasons, there's other psychiatric diagnoses, including depression, anxiety, that's why we need to have a good differential diagnosis, have a good assessment for the treatment. But if adequately diagnosed and with medication management, the results can be profound.
BregmanMD Medical Group offers online psychiatry and online therapy.